Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I've been having a tough time managing all my health issues, especially with everything else going on. It started with the prostate cancer diagnosis last year. Initially, I thought watchful waiting would be sufficient, but the anxiety of waiting it out got too much, so I've opted for surgery now.
I understand that must have been a difficult decision. It's important to feel comfortable and secure with the treatment plan you choose. How have you been feeling otherwise?
Well, my diabetes has been quite erratic. I know I'm supposed to take metformin twice a day, but there are days I just forget or feel overwhelmed with the dosages, and the blood pressure isn't helping either. My last reading was high again, and I think the current dose of atenolol might not be enough.
It's not uncommon to feel overwhelmed given your situation. Managing diabetes effectively can be challenging, especially with varying medication adherence. We'll review your treatment and see if adjustments are necessary.
And then there's my cholesterol. Sometimes I take the full dose of simvastatin, other days just half. I guess I'm just not consistent with it.
Consistency is key in managing hyperlipidemia. We might need to explore ways to help you keep track of your medication better. You also mentioned concerns about your weight?
Yes, I've been gaining weight, and it's concerning. I was advised to join the MOVE program for weight management. I think it's a good idea, but I haven't signed up yet.
Weight management is crucial, especially in controlling diabetes and improving overall health. Joining the MOVE program can provide you with the support and guidance you need.
There's also the matter of my potassium levels. I've always avoided bananas due to past gastrointestinal issues, so now I'm supposed to start taking potassium chloride supplements.
Correct. Maintaining adequate potassium levels is important for your heart health and other bodily functions. We'll start you on potassium chloride to address the deficiency.
And I haven't even mentioned my wife's condition. She's in hospice care now, and it's been incredibly hard on me, trying to manage my health and be there for her.
That's an enormous strain to bear. It's important to take care of your own health so you can be there for her. Have you had any support during this time?
It's mainly been friends and some family. Honestly, it's just a lot to handle all at once. And with the foot numbness, I'm worried about peripheral neuropathy too.
We've scheduled you for an eye examination and a further assessment of your peripheral neuropathy. Keeping a close eye on these will help us prevent any severe complications from diabetes.
Thank you, doctor. I also need to decide about the colonoscopy. It's just that with the upcoming prostate surgery, I'm not sure about the timing.
We'll consider the best timing around your surgery. It's crucial, but we can schedule it when you're ready. Based on today's discussion and your medical history, here's our plan. We'll monitor closely to see how you respond. I'll also streamline your diabetes management by setting reminders for your metformin and exploring the possibility of adjusting the regimen to better suit your daily routine. For your cholesterol, I urge you to take simvastatin consistently. We can discuss potential side effects or concerns you might have that lead to varying doses. Enrolling in the MOVE program for weight management is critical. I'll refer you to our dietitian who can help set up a plan and provide ongoing support. Continue with the preparation for your prostate surgery. We'll ensure you have all the information and support you need leading up to and following the procedure. We'll schedule the colonoscopy post-surgery at a time that's feasible for you. For the eye and foot examinations, these are scheduled for next week. It's crucial to manage your diabetes complications proactively. Lastly, please consider seeking additional support for coping with your wife's care and your own health. This might include counseling or support groups. We'll continue to monitor your lab results, including A1C, cholesterol and potassium levels, and adjust the treatment plan as necessary. It's important that we tackle each issue systematically to improve your overall health and quality of life.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I think it's important to start by saying that these knee spasms are still really affecting my sleep. I've tried adjusting my position in bed, but nothing seems to help for long. It started a few years back, but it's gotten worse over the past few months. I had to stop using the cane because I thought I was getting better, but these spasms, they're just different from pain. You know, it's more of a sudden tightness that just grips me, especially at night.
I understand that must be very frustrating for you. It's good to hear that you're managing without the cane, but we need to address these spasms effectively. Can you tell me a bit more about when you first noticed these spasms and how they've progressed over time?
Well, it began mildly around the time I had my spinal surgery. At first, they were just occasional, but as I mentioned, they've become more frequent and intense. I've been trying to manage it without taking too much medication. I'm already on amlodipine for my blood pressure, and I'm wary about adding more unless absolutely necessary. That's why I've been holding off on the ibuprofen.
That's completely understandable. It's important to manage these symptoms without overwhelming you with medications. You mentioned your spinal surgery. Could you remind me of the details around that and how you felt afterwards?
Sure, the surgery was about 5 years ago. It was meant to relieve some persistent back pain I had been experiencing. The surgery itself went well, but recovery was tough. I started noticing these spasms a year or so after the surgery. They weren't directly related to the surgical site. It was more on my right knee, where I've had chronic issues.
Thank you for clarifying. And how about your overall mobility now compared to before? Any changes in your daily activities or things you find more difficult to do?
Definitely, I've noticed a decline. I used to walk every morning, but now I'm more sedentary because of the spasms. Sometimes even walking can trigger them. I've adapted by reducing my activities, which I know isn't ideal for my health overall.
It's good that you're adapting, but let's see if we can improve your mobility too. Let's talk about your recent healthcare visits. Your last MRI showed osteopenia in the cervical spine. Have you had any symptoms related to that?
Not really. No numbness or tingling, just the spasms. I missed my knee MRI because of a transportation issue, but I know we need to reschedule that to get a clearer picture of what's going on.
Right. We'll definitely reschedule the MRI for your knee. It will give us more insight into the structural aspects and help in planning your treatment better. You also mentioned your visit to urology last September. Can you tell me a bit more about that?
Well, it was a bit confusing, honestly. They talked about ongoing monitoring and some treatment options, but I told them up front that I'm not interested in aggressive treatments. I want to focus on managing my current conditions without adding more heavy medications.
I see. It's important to align your treatment with your preferences and quality of life considerations. Let's make sure we have a follow-up with them to clarify your treatment goals and expectations. Now, considering everything, I'd like to go over our plan moving forward. First, we'll reschedule the MRI for your knee. Based on the results, we'll consult with orthopedic surgery to see if there are non-invasive treatments that might help with the spasms.
That sounds good to me. I just want to find a way to manage these spasms better so I can get back to doing more.
Absolutely. And we'll also explore the option of salsalate for managing your symptoms. It's less harsh than ibuprofen, and it might be a good compromise to help you with the spasms without increasing your medication load too much. I'll see you back here in March unless we find something urgent on the MRI. In the meantime, please don't hesitate to contact my office if your symptoms change or if you have any concerns.
Thank you, Doctor. I appreciate you helping me navigate all this. I'll make sure to keep you updated and follow up with the MRI as soon as possible.
You're welcome. Take care, and we'll make sure you get the support you need to manage these symptoms more effectively.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
I understand your concerns about fertility, and it's great that you've come to discuss this. Can you tell me more about your medical history and any symptoms you're experiencing?
Sure, doctor. My partner and I have been trying to conceive for over a year now without success. I have irregular menstrual cycles and sometimes they're quite painful.
Those symptoms can be challenging, but there are several options we can explore. Have you done any preliminary tests, like hormone levels or an ultrasound?
I had an ultrasound last month, and they mentioned something about possible polycystic ovary syndrome, but I didn't get a clear answer.
PCOS can indeed affect fertility. I recommend a hormonal profile test to confirm this, and depending on the results, we can consider medications to help regulate your cycles and improve ovulation. We can also look at lifestyle adjustments or possibly even surgical options if necessary. It's important to cover all bases to give you the best chance at conception.
Now look at question 26.
Welcome, everyone. Today we're going to discuss effective rehabilitation strategies for athletes recovering from injuries. Our goal is to restore full function and prevent re-injuries. We'll start with the acute phase, focusing on reducing inflammation and pain management. Moving on, we'll address the importance of controlled exercises to regain mobility and strength. Lastly, we'll cover sport-specific exercises tailored to ensure each athlete can safely return to their sport. Each phase of rehab is crucial and must be tailored to the individual's specific needs. Today's session will also include demonstrations of key rehabilitation exercises, and we'll discuss how to adapt these techniques to suit different types of sports injuries.
Now look at question 27.
I see you've been experiencing worsening back pain. One option we can consider is using complementary medical devices, such as lumbar supports or TENS units, which might help manage the pain.
I've heard about TENS units. How exactly do they work?
A TENS unit delivers small electrical impulses through the skin to the nerve fibers, which can help block pain signals to the brain and also raise the level of endorphins, your body's natural painkillers.
That sounds promising. Is it safe to use with my current medications?
Yes, it's generally safe, but I'll tailor the settings to suit your specific needs and ensure there are no contraindications with your medications. We can start with a trial period to see how you respond, and if you find relief, we can make it a regular part of your pain management routine.
Now look at question 28.
Good afternoon, everyone. Today we're focusing on our hospital's quality improvement initiatives. Our main goals include enhancing patient safety, reducing wait times, and improving surgical outcomes. We've implemented several new protocols, including a revised handoff procedure between shifts to reduce errors and improve communication. Additionally, we are updating our electronic health records for better real-time data access. We encourage feedback from all staff as these changes are implemented, as your insights are invaluable in this process. Continuous improvement is our priority, and these initiatives are just the beginning of our journey to achieve excellence in healthcare.
Now look at question 29.
I appreciate you opening up about your eating habits. Binge eating disorder is more common than many think, and it's important to address it comprehensively. How often do these binge episodes occur?
It happens about 3 times a week. It's like I lose control and can't stop eating, even when I'm already full.
Thank you for sharing that. It helps us understand the severity. Treatment often includes therapy to address the emotional triggers of binge eating, along with strategies to develop a healthier relationship with food. Would you be open to starting with a therapist who specializes in eating disorders?
Yes, I think I need to get some help. It's been too much to handle on my own. I feel overwhelmed and guilty after these episodes. I'm ready to take steps towards recovery and appreciate your support and guidance in this process.
Now look at question 30.
Today's training session is crucial as we discuss medical malpractice and how to safeguard against it. Our focus will be on understanding what constitutes malpractice, the importance of documentation, and how to maintain high standards of patient care. We'll go over common scenarios where malpractice claims typically arise and discuss strategies for effective communication and accurate record keeping to protect both our patients and ourselves from potential legal issues. Remember, prevention starts with awareness and proper education. By the end of this session, you should feel more confident in your daily practices and understand the critical role you play in mitigating risks in our healthcare environment.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at extract 1.
Welcome everyone to today's webinar on the evolving landscape of COVID-19 immunity and vaccination strategies. I'm Dr. Edward Miles, an infectious disease specialist, and today we'll delve into the complex interplay of naturally acquired immunity and vaccine-induced protection against COVID-19, with a focus on the implications of the Omicron variant. Our discussion will also include a relevant case study that highlights the real-world application of our topic. To begin, let's address the core question many healthcare professionals and recovered COVID-19 patients are grappling with. Does vaccination enhance the naturally acquired immunity from past infection? This has been a critical area of research, and recent findings suggest that the answer is complex and varies by demographic and the specific variant of the virus involved. A pivotal study published in the New England Journal of Medicine by Dr. Ronan Arel and his team at Clalit Health Services in Israel provides significant insights. They investigated the effectiveness of the Pfizer-BNT vaccine among individuals who had recovered from COVID-19. Their study encompassed over 150,000 individuals and revealed some intriguing findings. Primarily, the study indicated that vaccination in individuals who had recovered from COVID-19 significantly boosted their immunity, reducing the risk of reinfection by about 80% in individuals under 65. However, in older adults, this reduction in risk was about 6%. Interestingly, their data suggested that a single vaccine dose might be sufficient to significantly boost immunity in recovered patients, with no apparent additional benefit from a second dose. This leads us to consider the biological rationale behind these observations. It's understood that the immune response elicited by natural infection can be robust, but the addition of vaccine-induced immunity acts to further enhance and broaden the immune response, particularly against emerging variants. Let's discuss a case study that exemplifies these findings. We recently managed the care of a 57-year-old patient, Mr. Thompson, who had recovered from a COVID-19 infection caused by the Alpha variant. Mr. Thompson was initially hesitant to receive the vaccine, feeling protected by his previous infection. However, given the emergence of the Delta and subsequently the Omicron variants, which are known to partially evade natural immunity, we recommended vaccination. Mr. Thompson received a single dose of the Pfizer vaccine 6 months post-infection. Subsequent antibody testing and immune profiling demonstrated a significant increase in his neutralizing antibodies, not just against the Alpha variant, but also against Delta and Omicron. This enhancement of his immune profile likely contributed to his avoidance of reinfection during the recent surge in cases driven by the Omicron variant, despite high community transmission rates. This case underscores the importance of adapting our vaccination strategies in light of new evidence and the evolving viral landscape. It also highlights the need for ongoing research. Current studies are now focusing on the duration of immunity provided by the vaccine in recovered patients and the effectiveness of boosters against variants like Omicron. As we look ahead, the key takeaway for healthcare providers is the nuanced approach required in discussing vaccination with patients who have recovered from COVID-19. It's crucial to communicate that while natural immunity provides a baseline of protection, vaccination offers a significant enhancement, especially in the context of variant evolution and the different immune response profiles in various age groups. The interplay between natural and vaccine-induced immunity is a testament to the complexity of the human immune system and the challenges of managing a pandemic. The strategic integration of vaccination in recovered patients should be guided by ongoing research, patient-specific factors, and the prevalent circulating variants. As healthcare providers, our role in educating patients and adapting strategies based on emerging data is more critical than ever. Thank you all for attending today's session. I hope this discussion has been informative and will aid you in your clinical decisions and patient conversations about COVID-19 vaccination post-recovery. We must continue to rely on rigorous scientific research to guide our practices in these unprecedented times.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Good afternoon, everyone. Today, we will delve into the complex interplay between drug pricing, patient access, and innovation, particularly focusing on the U.S. healthcare system. This conversation draws heavily on scholarly articles from Harvard and other esteemed sources, allowing us to explore the multifaceted challenges and implications of drug pricing. Now, to kick off our discussion, let's consider the role of drug prices in healthcare. It's no secret that the United States has some of the highest drug prices in the world, a situation that significantly impacts both individual patients and the broader health system. High drug prices are often justified by the pharmaceutical industry on the basis of the high cost of research and development, regulatory hurdles, and the need for innovation. However, these high costs pose a significant burden on patients, especially those without adequate insurance coverage or those under plans with high deductibles. Let's examine a case study that highlights these issues vividly. We have the case of a patient. Let's call her Miss Thompson. Miss Thompson is a 58-year-old who was diagnosed with multiple sclerosis, MS, in her early 40s. MS is a chronic and potentially debilitating disease that affects the central nervous system. The progression and symptoms of MS can be managed with several types of medications, many of which are incredibly costly. One of the primary drugs prescribed for managing her MS symptoms is priced at over $7,000 per month without insurance. Despite having health insurance, Ms. Thompson's out-of-pocket expenses remain prohibitively high due to her high deductible plan. This case starkly highlights the issue of accessibility even when medications are available. Moving forward, the concept of value-based pricing has been suggested as a solution to align the cost of drugs with the value they provide, rather than the current market-driven pricing strategies. Value-based pricing involves setting drug prices primarily on the benefits they provide to patients and the healthcare system, rather than solely on production costs or market demand. This model aims to ensure that patients have access to drugs at prices that reflect their actual therapeutic value, which could potentially support innovation while also making healthcare more affordable. Interestingly, organizations like the Institute for Clinical and Economic Review, ICR, in the United States play a crucial role in evaluating the cost-effectiveness of new drugs. They use a metric known as the Quality-Adjusted Life Year, or QE, to assess the value drugs provide to patients in terms of both quantity and quality of life. For instance, if a new drug for MS could effectively slow the disease's progression and improve the quality of life for patients like Ms. Thompson, its high cost might be justified under this model. However, the challenge remains in ensuring that these drugs are still accessible to all patients, regardless of their financial situation. Moreover, the debate around drug pricing isn't just about economics. It's also a moral one. The ethical dimension considers whether it's justifiable for a society to allow market dynamics to dictate access to potentially life-saving or life-enhancing treatments. This is particularly relevant in cases where patients might forego necessary medications due to cost, which can lead to more severe health outcomes and higher overall healthcare costs due to hospitalizations or emergency care. In addition, it's crucial to discuss the implications of patent protections and market exclusivity on drug prices and innovation. While these protections are intended to incentivize pharmaceutical companies to invest in new, risky research and development, they also lead to monopolies that can sustain high drug prices long beyond the recovery of the initial R&D investments. The balance between encouraging innovation and preventing monopolistic practices that can hinder access to essential medications is delicate and requires careful policy consideration. Finally, looking at policy reforms, several proposals have been suggested to improve drug affordability. These include more rigorous negotiations by Medicare on drug prices, implementing international price indexing, and promoting greater transparency in drug pricing and R&D costs. These measures aim to create a more equitable healthcare system where drug prices are both fair and supportive of continued innovation. Tackling the issue of high drug prices in the U.S. requires a multifaceted approach that considers economic, ethical, and health outcomes. Policies need to be carefully crafted to balance the need for innovation with the necessity for patient access to affordable medications. The case of Ms. Thompson is just one of many that illustrates the urgent need for reform in how drugs are priced and paid for in America.